On behalf of the Board of Governors and our committee, which consisted of Rodney Hood, Joan McNeil, Craig Souza, and myself, it's my privilege to introduce the recipient of the 2014 Governor James E. Holshouser Jr. Award for Excellence in Public Service. After thoughtful and careful consideration of many qualified nominees, and I can say there were many and they were really highly qualified, the Board of Governors has chosen Dr. Kurt B. Michael, Professor of Psychology from Appalachian State University and Principal Investigator of the Assessment, Support, and Counseling, that's called ASC, but it's pronounced ASK, Center and University School Partnerships, as this year's recipient. We are pleased that several of Dr. Michael's guests are here today. You honor us with your presence. Would you please stand and be recognized as I call your name? Dr. Michael's wife, Amy, their son, Connor, and daughter, Olivia, are here. Dr. Michael's colleagues from Appalachian State University, Dr. Jim Dennis, Department of Psychology. Ms. Christina Menard, Mental Health and Allied Health Consultant from the North Carolina Department of Public Instruction. Dr. Angela Quick, former Deputy at North Carolina Department of Instruction and Principal of Watauga High School. Dr. Scott Elliott, Superintendent of Watauga County Schools. Dr. Todd Holden, Superintendent of Ashe County Schools. Dr. Stanley Eshelman, Interim Provost at Appalachian State, who hired Dr. Michael in 1999. Thank you. We also wish to recognize Sherry Everts, Chancellor of Appalachian State, for her outstanding leadership. Chancellor Everts has been at the helm for only 3 months and it is already off to an impressive start. Let's give them all a stand. Thank you so much for being with us today. Dr. Michael truly epitomizes the dedicated educator who is fully committed to the highest ideal of public service and quality education through his work in the important field of mental health. The number of individuals diagnosed with mental health illnesses each year has been on the rise since 1970. As we know, mental health problems are very real. They're painful, and if left untreated, can have serious consequences. Recognizing the importance of having access to mental health care and strengthening leadership in the mental health sectors at all levels, Dr. Michael spearheaded a significant and groundbreaking initiative in the local school systems to address mental health issues. He founded the Assessment, Support, and Counseling Center, also known as ASK, at Appalachian State, which provides a comprehensive menu of mental health services, crisis intervention, and consultation to students and families on demand, and the development and training of highly skilled clinical mental health counselors and professionals. The ASK centers have expanded to Ashe and Allegheny counties. The impact that Dr. Michael's work has had in the communities is profound. His professional work in these communities has garnered significant positive attention and policy support in North Carolina, contributing to large federal grants to the state on rural mental health problems. Promotion. His collaborative efforts have enabled North Carolina to be at the forefront of school mental health endeavors. He and his colleagues, who we have greeted today, together have found pathways to give youth, student, and families struggling with behavioral health challenges the message of hope, to know that it's okay to ask for help, to know that treatment is available.
And we generally do it quietly. And I'm happy to know that people don't necessarily know a lot about us, because it means to me that we're doing our work.
Sustained and superb achievement in university public service and outreach, and you've contributed to improving the quality of life of the citizens of North Carolina and beyond. Board of Governors takes great pleasure in presenting the 2014 James E. Holshouser Jr. Award for Excellence in Public Service to Dr. Kurt D. Michael, Professor of Psychology and Principal Investigator of the Assessment, Support, and Counseling Center at Appalachian State University. Congratulations.
Here, here. Dr. Michael, we are immensely proud and immensely grateful for all that you have done to improve the lives of others and to make North Carolina a better place. Would you honor us with a response?
Wow. I'm really appreciative for all the things that were said, both in person and on video, and I'm actually even more grateful for all the things that were not said. It's getting kind of nervous there. So again, I want to begin my remarks by saying how honored I feel to be given the James Holshouser Public Service Award. My wife, Amy, my son Connor, my daughter Olivia, and I all came down from the mountains last night. We actually have a fifth member of our family who couldn't join us. We have an 8-week-old boxer puppy named Mayor. He's protecting the homestead in Boone. And as you might know, James Holshouser was in fact from Boone. And in preparation for today, I had a conversation with Governor Holshouser's personal secretary, Ann Shore, who actually lives in Boone. So we had a chat about a couple of weeks ago, and she still is a business owner in Boone. And she actually keeps a file for all of the governor's accomplishments. And I found a newspaper article around his inauguration in 1973, and the headline read, Scott's Turnover Mansion to the Man from the Mountains. So again, great pride to be the recipient of an award named after a fellow Boone person. He's quite a leader, a true champion of both higher education and public education for sure. So again, I need to reiterate how much I feel blessed and honored to be the recipient of this award named after one of North Carolina's most important public servants. And also want to express my great thanks to the psychology department and my colleagues in the psychology department, the folks who actually nominated me and support my work in school mental health and have done so unwaveringly from the outset. And I want to give special thanks to Will Canoe, J.P. Jameson, and Jim Denniston. So thank you. So just briefly, I want to tell you a little bit more about mental health in the schools, the initiatives we've been doing, and some hopes we have for the future. So about 25 years ago, my first professional job was in Winchester, Virginia, and I worked as a substance abuse counselor, and the agency I was working for had a contract to work with the public schools. And so it was then that I first began to work with kids in the schools. And I really, I think, realized firsthand just how important it was to not only help deal with some of these things they were struggling with, whether it be substance abuse, but see how these things had a direct impact on their school performance. And so it was really then, 25 years ago, that I realized that the best work with kids had to happen in schools when they were young. Right? So you saw firsthand not only were you able to reduce and deal with some of the struggles that they had, but they tended to become better learners. And so it was then, I think, that the light bulb came on. So when I eventually returned to complete my PhD, and after I came to Appalachian, I had about 10 years experience knowing full well the impact of doing work in the schools with kids. So I left Duke after my internship in '99, came to the mountains with really the dual tasks of raising my family and also establishing myself at Appalachian. And I began to try to establish partnerships in the schools. And I had a lot of doors closed in front of me, which was at times very frustrating. And at my probably lowest moment, my wife, who knows me better than anybody and provides me with unbelievable support, said, okay, so now that you've had this one more door closed in your face, you need to call Angela quick. And I did, and my wife said she'll get it, she'll understand. And so I had that conversation, and what was amazing is that Angela is one of those educators that is incredibly innovative. And I think without her leadership, without her presence in the building, I don't know that it would have happened. So I have every reason and right to really thank her deeply, because I think without that, none of this is happening. And so again, we both, I think, collectively observed that, doesn't it make sense that there's lots of kids at Watauga at the time that really do need this help, and we have the workforce to help. We have all these resources at ASU, so the marriage seemed obvious, and more obvious as we began. And so really we were a fairly small crew, it was just three of us. It was Angela, me, and a police officer named Bill Hartley, who would basically roam the building in search of kids in distress. And we didn't have to look too hard. And so we began to operate this way, and we eventually were successful at convincing the administration that it was a valuable partnership. And so additional contracts ensued. And so what was once a part-time, three-person endeavor has really, I think, burgeoned into this 40-hour-a-week, 5-day a week operation in 2 school districts, and 2 to 3 days a week in a third. So I think we're showing some nice growth. So it's been amazing. And the other amazing thing is to witness families and kids conquer some of these burdens. And a lot of these families, and when you first meet them, have no, often there's that stigma. They don't necessarily think that it's important or valuable or useful to seek professional help for things like depression or suicide. But it's really amazing to watch them shift from folks that would otherwise be unwilling to receive mental health treatment to be full partners, engaged in the process of getting well, and that's really nice to watch. The second really gratifying thing is to watch students, that is students at Appalachian, graduate students across disciplines, really kind of catch fire and catch the passion for helping young people in the schools. And so that's, just like you heard on the video, how important I think it is to help our young students, that is in graduate school, develop their own passion. The only thing I only have really one regret, that we can only hang on to these incredible graduate students for only so long. In recent years, we've lost this tremendous talent to other states, University of Texas, Oregon, Wyoming, Purdue. And again, I think that's excellent for them to go on and do great things. We've also been fortunate that we've been able to hire a lot of our graduates in Western North Carolina, so we can train them and retain them to stay in the mountains and work with these young people, and we really appreciate that, especially through some of the grants that we were able to achieve. And the other thing, just to let you know about our hopes, is that we're hoping to develop doctoral level internships in the mountains so they can come and train there, with our hopes of them staying there. And maybe one day we'll get a chance to have a PhD program in rural clinical, but that's probably for another conversation. But I just want to say how amazing it is. You heard Cameron on the video, and Cameron worked with me for about 7 years, and we lost him to his PhD program at University of South Carolina. But I think eventually, if we have enough students that we send down there, we can call University of South Carolina Appalachian South. So that's my secret plan, to take over Mark Wheat's operation down there. So in wrapping up, please let me say how blessed I feel to receive this award. I'm so glad that you decided to shine a bright light on such an important topic, a public health issue that affects so many of our youth. And I hope that you continue to support our efforts at addressing these major public health concerns in the years to come. Thank you.
Dr. Michael, I did not know you went to Duke. This is a time of great excitement and satisfaction as the Board of Governors honors Dr. Michael and his many colleagues across our great university who strive on a daily basis to serve the public in a way that enhances our quality of life. I think I can also say this is the best moment of the week for the University of North Carolina Board of Governors. So thank you for allowing us to have a great, great, great celebration with you. We're very proud of you.